Welcome back to SurG-Net. I'm extremely excited today of having a conversation with our guest, Chris Lavy. He's a professor of Orthopaedic and Tropical Surgery and consultant of Orthopaedic and Spine Surgeon at the University of Oxford. And also he works for the Nuffield Department of Orthopaedics, Rheumatology and Musculoskeletal Sciences, NDORMS. Thanks for being here, Chris. It's a pleasure. How are you?
Very well. Thank you, Antonio. It's a pleasure to be with you here.
I noticed that you studied anthropology before becoming a qualified doctor in 1982. I'd like to know a little bit more about those times when you were an anthropology student, and how was that jump that took you from being the student of anthropology to an orthopedic surgeon?
I started becoming interested in anthropology, physical anthropology, that is, skeletons and skulls and the physical origins, because I was very interested in knowing where we as humans came from. Going to the caves and the digs where so-called human origins and ape men were, and I did have some interesting times in various parts of sub-Saharan Africa, looking at the various skulls. So how did that move me to becoming interested in orthopedics? I suppose once you've started with bones, you stay with bones. I'm a practical sort of person rather than a cerebral sort of person, and I like doing things with my hands. And orthopedics was a very attractive career where you take broken and injured people and put them back together again. It's extremely rewarding, fixing broken things and when they return to some semblance of normality.
Thanks for the answer, Chris. You went to Malawi in 1986 and you stayed there for 10 years. During that period of time, you did a lot of things. Let me just read some of them because I reckon they are very, very interesting. And you helped to set up 2 orthopedic teaching hospitals and research centers in Malawi and Zambia, and helped to set up national orthopedic surgical and clinical officer training programs in Malawi, and also an international Clubfoot treatment program. Before going and talking about those things in depth, I would like to ask you something a little more generic. During that time in Africa, the experience changed your perception and your understanding of your profession?
Enormously, and it really changed my life and how I look at surgery and medicine globally. In the West, we very reasonably, when we become a doctor or we become a surgeon, you very reasonably think, what would I like to do? What branch of this exciting and interesting career shall I do? What excites me? And so you choose something, and you always find some patients to treat because there's lots of people who want treatment. Going to a resource-poor country, like Malawi, and when I arrived in Malawi, there was one other orthopedic surgeon there for 12 million people, but he was just leaving and retiring. He said, "Bye, Chris, you're on your own now." You look at the field in a different way, rather than saying, "What would I like to do? Shall I do hip surgery? Shall I do elbow surgery?" You actually say, "What's the need? Let's look at these 12 million people and see the problems that are there." And you set out your life and what you do according to the need that's there. And I can tell you the big need there wasn't hip replacement. The big need there was trauma, large amounts of trauma. And then the other big need, which caught my heart, was the thousands of children who couldn't walk for want of a relatively small operation. And within orthopedic surgery, there's big complex operations like some of the ones we do in Oxford on the spine, and there's simple operations such as dividing a bone and resetting it straight. And there were kids with terrible deformities, 90-degree deformities of their legs, which were relatively easy in orthopedic terms to fix. and didn't take very long, and completely changed the life of these children, and turned the child from being a child that could hardly stand up, to a child who could stand up and actually start walking and play with their friends and go to school and then get a job. And that's the branch of surgery that I spent a lot of my life following and encouraging.
And that is Clubfoot.
Clubfoot is a part of it, a relatively big part of it, yes. But essentially, it's operations that straighten out and correct the deformities of the lower limb. And Clubfoot, and the deformities of the lower limb that we see all around sub-Saharan Africa fall into 4 categories. There are those caused by trauma and injuries, either not treated properly or badly treated or untreated, and the child ends up with terrible deformities. Problems caused by infection, where the bone gets destroyed, or the growing part of the bone in a child, we call it the growth plate, gets deformed or damaged, and then the bone grows in an abnormal direction. So in trauma, infections, congenital problems, i.e. things that kids are born with, and clubfoot is preeminent amongst them. There are other conditions such as congenital dislocation of the hip, but clubfoot is much more common. And then there's another lump group of conditions, things that just develop, maybe because of vitamin deficiency or because of protein deficiency. But those are the 4 sort of categories of cause that cause conditions of the skeleton, where the bones end up deformed and the child ends up having difficulty walking or not being able to walk.
Thanks, that was very insightful. I would like to ask you about the Clubfoot training project that you created and now expanded to 15 countries. How do you get involved in it?
Well, we were very fortunate in the end of last century. I arrived in Malawi in 1996 and didn't have a lot of experience of treating clubfoot, and learned a lot of operations from colleagues who visited how to operate on club feet. But around about that time, a revolution in the world was occurring. Ponseti, a Spanish surgeon, was working in the US, and he perfected a method of treating the clubfoot by manipulation and carefully dividing a tendon rather than a major operation. And this method of treatment was revolutionary in countries such as Malawi, where there were very, very few surgeons. All of a sudden, we had a technique that people who weren't surgeons could be taught. I was very fortunate when I arrived in Malawi that this technique had just been introduced to Uganda by a man called Shafiq Pirani. And Shafiq and a couple of his colleagues, Norgrove Penny and Mikhail Steenbeck, came over to Malawi and taught us this technique. We then taught it to the non-medically qualified orthopedic clinical officers in Malawi and set up 25 clubfoot clinics up and down the country and established Malawi's national clubfoot program. Since I returned to the UK, working with an organization called Global Clubfoot Initiative, we've put together a teaching program, and we've worked with colleagues, as you mentioned, in 15 different countries up and down Africa. Great colleagues from those countries, honing and improving this teaching program, which we call the Africa Clubfoot Training Program. We set up this training program. It got more popular than we realized, and other countries wanted it. So we've now renamed it the Global Clubfoot Training Program, because I think some of the people from other continents didn't want a training program that had Africa in front of it. And most wonderful of all, in my own country, the National Health Service was interested in this clubfoot training program. So we've made a few adaptations, and we now deliver the program here in the UK as well.
Thanks for that. You also develop a surgery training for doctors and clinical officers in Africa. Do you reckon still nowadays there is reluctance for non-surgeons to do surgery? And from your experience, what do you think about it?
That's a really good question, and it really does depend on where the question's being asked. You know, sitting here in Oxford, if you had a spinal injury and your spine was broken, and I said to you, would you like a trained spinal surgeon to fix it, or would you like a paramedic who's had 18 months of training to give it a go? Well, it's a silly question, because you would like the thing done as well as it possibly could be done. If, however, you were in Malawi in those days in the mid-90s, would you like your fracture treated by an orthopedic surgeon? Yes, please. Well, there isn't one. Would you like it treated by a general surgeon? Well, there isn't one. Would you like it treated by a doctor in the rural areas? Well, there isn't one. Or would you like it treated by a trained professional who may not have a medical degree, but has done an 18-month training and has done hundreds of those injuries? Yes, and they can deliver a good service. It's not perfect. It's not the best that there is in the world, but it's the best that's available there. So when there's a choice between nothing and a well-trained, non-medically qualified practitioner, I would support that training. Now, obviously, as a country develops, and it's been one of the greatest joys in my life, really, to see Malawi develop. First, the medical school, which was just started when I arrived, and to see a bunch of trained Malawian doctors come out. It's been great to see that number increasing, and then increasing numbers of them doing surgery, and then increasing numbers doing orthopedic surgery. The situation's changed now, and there's I think almost 24 orthopedic surgeons in Malawi. And that's a total change from just one. The great thing about Malawi is that the two systems, the non-medically qualified orthopedic clinical officer system, does seem to be working well in conjunction with the highly trained postgraduate surgical specialist system. And okay, there's a few clashes here and there, but as a whole, as a system, it is working well together, and it's great seeing the country's quality and standards in orthopedics going up and up.
Thanks for your time, and thanks for finding this opening for having a conversation here in the Search Ahead.
A great pleasure, and it's wonderful to be a small part of working with the Royal College of Surgeons of Ireland. Thank you.
And for the rest of you, thank you very much for having watched this video. You can find the rest of them on our website, as you can follow our latest events and updates on our social media, YouTube, Twitter, Facebook, Instagram, whatever you please. Take care and keep yourselves safe.